On our poll, I guess it's representative, but it's not quantitative. The influence of friends of faith was said to be 0 in the issue of the vaccine. And the question is, how have you dealt with issues around faith that have emerged during this period of making choices about the vaccine? For instance, some churches promoting, particularly in Black-led churches, promoting the vaccine as the mark of the beast.
Mm. Yeah, I think, I mean, speaking from personal experience, one of the things which is very important is to engage with people rather than suppressing people because of particular views that they may have. And really trying to understand, well, where are they coming from? So, for instance, I mean, the mark of the beast is actually quite a good starting point where certain people have not made decisions because they've said, you know, look at the vaccine mandates, you know, it's possibly going to reduce freedoms, and it very mirrors, it parallels some of the things that people think might happen according to their particular theological viewpoint. The way that I've addressed that is first engagement by saying, yes, I can understand certain concerns, because if a vaccine mandate comes out, it's obviously going to impose some restrictions on the freedoms of people that don't necessarily take a vaccine. But what I think where faith groups have possibly gone wrong, I'm not saying all faith groups, but I think where faith groups have possibly gone wrong is where there have been situations where there's been forums to engage debate. There hasn't really been much debate, because essentially what has happened most of the time is that a forum is put together for the church community, and the people that are speaking are all, you know, are all pro-vaccine. And this comes back to what I said before. What people want is a diverse panel like what you're seeing tonight, so that people feel that there's a wholesome approach in terms of the question, and then that actually helps people to engage more in terms of the science, the data, the health outcomes, the things that are visible, things that we can see, things that we can actually base decisions on, because it's actually sort of true science or true data or true health outcomes. Because everybody's going to have certain hyperbole in terms of viewpoints that they may have. But I think if faith groups were more committed to making sure that panels were diversified, then I think that would have helped in a lot of ways in helping people not to feel isolated, because it's like, well, you're coming with some really kind of out there particular viewpoint, and that's absolutely wrong. I think engagement is key, and also making sure that people trust the leadership, that the leadership is presenting a diversified panel, because even within our church organization, the headquarters in America, in Cleveland, a matter of 3 weeks ago, actually sent out an official notification to all ministers to say, look, as a church institution, we recognize that within our church institution, there are people that are involved in the medical profession, there are people that are involved in the legal profession, and not everybody is in agreement. And as a church, we recognize that, and we basically say it's up to individual people to make their own decision based on the research that they do, and that it's not a matter for the church to dictate one way or the other what people should be thinking. And I think that's a mature approach, that people always think that they're not being cajoled into a particular direction, but they are presented with some, and when I say presented with different scenarios, we know that there are particular views that are just not right. You know, if the sky is blue, the sky is blue. Somebody tells us that the sky is green, the sky is blue. But certainly if we put together, you know, a very diverse and varied panel, then I think what that does, it helps people to engage, and it helps people to have confidence that the faith groups are actually presenting something that people can then make an informed choice based on the information.
Thank you, Reverend Les. Any more questions? We do have time for a few more questions.
Yeah, there is a question here for Reverend Les. For healthy individuals not in vulnerable groups, is not having a vaccine irrelevant, because doesn't waiting actually boost immunity in the long run due to herd immunity?
That's a really good question. I've talked a lot about people that are not vaccinated, that have had COVID, and most of those people who have had natural immunity. But the question about the unvaccinated is obviously a very different question. My particular viewpoint is that we have a situation where we've clearly vaccinated those who are most vulnerable. And what we now have is a situation where the government's vaccinating the over 50s, the over 40s, the over 30s, and it's working its way down, down, down. Now, we've always talked about collective, that we're in this, and even at the outset of the virus, a lot of the institutions, Bill Gates, and a lot of the pharmaceutical companies were talking about, we need a collective effort to basically manage the way that we come through this pandemic. But we have a situation where individual governments are talking about vaccinating everybody down, or even the people that are not defined as high risk. Yet we have billions of people in third world countries, billions of people in high risk groups, billions of people who are over 60 with comorbidities who can't get access to the vaccine. And so what we're seeing is that we're seeing so many inconsistencies. And again, this is what causes hesitancy, because people are saying we're talking about collective, yet how is it that one country can hoard vaccines, start vaccinating everybody, even the people that are not actually in high risk, yet we have billions of people in Africa, billions of people in parts of Asia that still can't get access to vaccines, even for the high risk groups. In addition to that, we also see imperialist attitudes coming through. The fact that the UK government is turning away people from third world nations just because the vaccine that they had wasn't manufactured in America or Canada or Europe. I mean, these are the things that cause hesitancy. To answer the question, though, in terms of an unvaccinated person, I think, again, you have to make a risk-based choices. If it's the case that you've decided that you are a healthy person, you're not in a high risk group, then I think you've got to, as we said, in terms of a portfolio approach, because this thing can still kill anybody. Even if somebody's healthy, the virus can still take you out. It's just the fact that there are more groups that are at risk. So what I would say is that if you're somebody who's unvaccinated and you've made a clear decision that you don't want to take the vaccine, especially if you're somebody that counts yourself healthy, don't rest on your laurels. Do everything that people have talked about today in terms of making sure that if you're deficient in any particular vitamins or minerals, that you take the necessary supplements, obviously with doctor's advice, but your whole well-being, your spiritual well-being, your mental well-being, take intolerance tests, there are various tests out there that can help you to actually even mount a more formidable defense outside of the vaccine. So I think a lot of people, you have to make a risk-based decision based on where you are in terms of whether you are predisposed to being more at risk or whether you are not. But at the end of the day, everybody just needs to be aware that this is a virus, just like people can be killed by the flu, regardless of what age you are. It's just that more people are predisposed more than others. But I think the bottom line is that we all need to be doing what we can do to create a stronger immune response in terms of our body's vitality and ability to ward off any illnesses that may come our way.
You're on mute, Delroy.
Yeah, sorry. Thanks a lot, Reverend Les. Any more questions, Denise?
Yeah, hopefully we don't lose Dr. Ludmilla. Right. There's a question here. Do you think we need to take the booster vaccine?
So I don't think that that the vaccine that any of the shots by themselves are the ideal. So I say finish what you start, because we don't have enough data of the efficacy of the whole thing. So if you did the first two, then the booster is not going to me anyway, that's my opinion. I'm taking the booster because I'm thinking, well, I don't have enough data for the other two, but if I already expose myself to them, I'm going to take the booster. Because if your concern is data, then there is not enough data. We already know that. But if there's anything that may reduce the risk of being hospitalized, not the risk of the virus, but the risk of being hospitalized, then I say, yes, do the booster. So I'm taking the booster because I want to reduce the risk of ending up in the hospital. And then I'm going to take control of my own situation by doing everything nutritionally to make sure that my immune system is strong. And that way, because I know that I'm in control, I'm not afraid of the booster.
Right. Okay.
So I hope that helps.
Okay. Thank you, Dr. Ludmilla. Denise, any more questions?
There is a question here. I'm not quite sure who it's directed to or who it could be directed to. Can anyone in the UK request antibody tests to ascertain if they've previously contracted COVID-19?
That's possible for Dr. Marion, would you know, or Dr. Michelle? Based in the UK, of course, and maybe, yeah. Dr. Michelle?
There is a test that once you've had COVID, you can actually get tested for that. You can also request it, but you may have to pay for that. But once you've had COVID, they actually seek you out because they want to test your antibodies. So you go for a blood test, because my daughter had COVID and she was sent a letter saying, please can you come? So she gave her, and she's protected. She has developed the antibodies, but also going back to those that require COVID vaccination and those that do not. My 2 grandchildren had COVID and they recovered within a matter of 2 days. And my daughter had it, and she's a pediatric nurse, and it took her over 2 weeks to recover. So children seem to have a high immunity to it, some children, but once again, it's nutrition. They're vegan and they've always been vegan, and they do a lot of exercise because they're young, so they're always running around. So it's taking control of your health. But yes, your antibodies can be tested if you've had COVID or you think you've had it, or you can request to have it done, but maybe it's a small cost.
So I just want
that helps.
to add to that and just say as well, you need to keep testing your antibodies because there is an expiration on that. And I think I've heard numbers from 3 months to 6 months to sometimes 10, and it's very person dependent. And so, you know, you want to, if that's the route that you go, know that you will need to really continue to test to really understand your kind of vulnerability.
Another question. Oh,
sorry. Yeah, I just wanted to echo, it's a good point that was raised by Dr. Michelle in terms of, yeah, you can get antibody tests. Like, for instance, you've got private healthcare firms like Bupa that will allow you to come in and do an antibody test for anything. I think it's sort of averaging around sort of 50 to 60 pounds. I would just say this though, from an immunological perspective, the antibody test isn't necessarily the most accurate indicator of immunity. What is the most accurate indicator of immunity is what they call the memory B cells or the memory T cells, and these are what so even when your antibodies start to wane over time, it's the memory B cells and the memory T cells that hold the memory of what the body went through in terms of being able to generate those antibodies again if you ever come into contact with COVID. So it's just very important just to highlight the fact that antibody tests are good, but just be aware that you could have had COVID a year ago, and then you go and get tested and they say that you haven't got any antibodies. It doesn't mean that you don't have immunity. It's just the fact that those antibodies have actually waned over time.